Well, my name is Frank Tindall and I'm an orthopedic surgeon. And it's kind of an interesting story as to how I eventually ended up in orthopedics. I initially was an athlete. I mean, I still am an athlete of sorts. My dad was a football coach in Canada and a basketball coach. And of course, our whole life was sports. So I eventually became a football player, and I was going on to become a professional football player. But in the course of the championship intercollegiate football game, I fractured my neck, which kind of put an end to my football career. But at that stage of the game, I kind of developed a respect for the individuals that were looking after me. Since that time, I've looked after many teams in both Canada and the United States. Our interest really is getting people back into action, be they high school Pop Warner football players or little octogenarian ladies that fall off their bicycles and break something. The idea is to get them back into action, and that's been very rewarding.
Hi, I'm Mike Gibbs, and my dad and I started a project back in the mid-90s. We wanted to build an airplane, and 11 years later, I got to enjoy it for an entire summer before it met an untimely end. A few miles west of Payson, we met the side of a mountain, sat there for 5 hours waiting for someone to find us and take us to the hospital. In that time, I lost 4 units of blood, mostly through my left shin, and stopped breathing when the helicopter landed on the pad at the hospital. Slept for a couple of days until they decided it was time to wake me up.
Michael came in, of course, as what we call a blue alert, which is a significant traumatized patient. He sustained a pretty significant facial smash, as well as having open fractures to both his lower extremities, both his legs. This was complicated by the fact that hot oil had dripped on his legs and virtually burned his skin. He had third-degree burns over the skin of both his legs, which precluded us from doing anything specifically with the bones at the time, like fixing them with internal fixation devices such as plates and screws, because the plates would have been sitting right out in the open air. So it was necessary to apply an external fixation device, which involves drilling pins into the bone, attaching a framework to these. And this would allow the bones to help heal, but it would also make the limb accessible for the plastic surgeons to obtain skin grafts, muscle grafts, etc., to get coverage over the bones. So he was a challenge from the get-go.
I didn't know it, but it was my passenger's wife, who's a medical doctor, who had called over here and asked for Dr. Tindall and my plastic surgeon as well. And so they were handpicked. Since I broke both legs below the knee, that was the main thing. And I guess the initial surgery was due to the fact that they couldn't find a pulse in my foot. So they said, yeah, we got to get on that right away. So I had external fixators or halos on my legs for about 4 months. And then I graduated to fracture braces, which was great because finally I could sleep on my side again. And then a year of physical therapy later, back on my feet, riding motorcycles, bicycles, flying airplanes again, driving my car, hiking. So between the titanium plate in the wrist and the 55 screws and 24 plates in my face, all around the eye orbitals and jawbone and stuff, everyone thinks that I will set off the machines at the airport, but I don't, so.
I mean, this fellow has an amazing attitude, and I think this is very important in all these people. We try and instill this into our patients, a very positive attitude, and he's always had that. He's a positive kind of guy, and I think that combined with the physical therapy has resulted in the excellent results which he's had today.
One of the things that's just amazed me about Dr. Tindall and his assistant Char, they both have such great senses of humor. We just had an instrument rapport, and so really put you at ease even when you're really busted up. And you know, some people are concerned about your prognosis, but you feel positive because they have a positive attitude, and it's contagious.
I can't think of anything else that I'd rather do. After I injured my neck, I went on to become the head coach of the Royal Military College in Canada, which is Canada's West Point. And I coached football there. But I still had this passion for sports injuries and orthopedic surgery, and that's why I became an orthopedic surgeon. And it's never left me. That desire has never left me.